All right, now, let's talk about diphtheria. Though the outbreak was reported in Nigeria in 2011 and, of course, in 2022, not a lot is known about this particular dangerous infection. Now, tell us in simple terms what this particular disease is about and how it can be identified.
Yeah, so diphtheria is a bacterial infection that affects the nose, the throat, and sometimes the skin of an individual. It is caused mainly by a bacteria called Corynebacterium diphtheria and rarely by other strains. And that's the C. alterans and pseudotuberculosis. It can be very serious and sudden in onset as symptoms begin to manifest 2 to 10 days after getting infected. It can be transmitted easily by direct contact or by air through coughing or sneezing. It may also be spread by contaminated clothing and objects. In mild cases, symptoms might mimic malaria or cold, presenting as fever, runny nose, sore throat, cough, and red eyes. And in severe cases, thick gray or white patch on the tonsils or at the back of the throat. This will block the airway, making it hard to breathe or swallow and can cause the patient to have a barking cough. And when left untreated or poorly treated, complications like damage of the heart muscles, nerve damage, kidney problems, and bleeding problems may occur.
Now, of course, these are really, really serious, symptoms right now. Now, with the number made available by the NCDC, it appears the infection is more prevalent in the northern part of the country. Any particular factor behind this?
Okay, so this can actually be attributed to the reduced vaccination around that area. Diphtheria is a vaccine-preventable disease, and since the northern part of Nigeria experiences reduced access to healthcare and vaccination compared to the south, this could cause a higher incidence. And also, there is usually a low access to immunization programs in areas affected by conflict and insurgency, and this would show some levels of low access to immunization programs. And now, other factors may include sociocultural factors like high poverty index, low compliance rate, poor health-seeking behaviors, overpopulation and overcrowding, malnutrition, poor sanitation, and amongst other factors.
Kelechi, these are really, really, disturbing, figures we are beginning to see, and of course, the trend. Now, WHO and other sources say vaccination is the most trusted way of staying safe from the infection. Now, with the negative mindset in some communities towards vaccines, are there other effective means of preventing or prevention against being infected by the bacteria?
Surely, full vaccination with the DPT vaccine, which is a combination of diphtheria, pertussis, and tetanus vaccine, which is given 6th, 10th, and the 4th week of life, is the most reliable and sure way to prevent diphtheria. Currently, only 42% of children under 15 in Nigeria are fully protected from diphtheria. And in the most recent outbreak, 80% of the confirmed cases have been found to be people who are unvaccinated, and those who are badly affected are children between 5 to 14 years. So now you see why vaccination is really important. So if you're fully vaccinated, then you're protected even when you come in contact with infected body fluids. But other ways to reduce the risk of infections would include practicing a good hygiene, avoiding close contact with infected individuals as it is highly contagious, covering your mouth and nose. Now, this would be a good time to remind us of our COVID-19 precautions of regularly washing your hands and using a face mask, and also avoiding sharing personal items. And if you're traveling to areas where diphtheria is prevalent, consider getting vaccinated before your trip.
Now, finally, before I let you go, what public health measures can be taken to actually curb the spread of the infection?
So I'll just be direct with this one. Now will be the time to start fresh vaccination campaigns. Now is the time to introduce health education initiatives in the communities, and also online social media, awareness to improve awareness across the nation, both at the grassroots and on social media. Also, effective monitoring and surveillance would help to control the spread of diphtheria. So as this is going on, let us have information of what's going on, how we can control, how as individuals we can join, to curb the effects or the constant spread of the infection, and then, continuous engagement between the government and the health organizations.
Dr. Kelechi Okoro, thank you so much for your time.
Thank you so much for having me. Yeah.